In this video, we're going to look at some myofascial exercises to help with chronic pelvic pain. Many people suffer from chronic pelvic pain symptoms, both men and women, and this can include pain in the pelvis, the genitals, groin area, even into the rectum. And also a lot of people have other symptoms such as digestive issues and also urinary urgency or frequency. So chronic pelvic pain can be caused by all sorts of things, and for most people it's usually a combination of issues. So sometimes it can be overuse through too much sport or too much sitting, or it could be due to surgery, or it could be due to stress. So a lot of people are told when they have chronic pelvic pain that the problem is that their pelvic floor is too weak and it's not supporting them. In actual fact, in my experience, it tends to be that the pelvic floor is too tight and in spasm. And because of where your pelvic floor is, which is right at the bottom of your pelvis, supporting your internal organs, it is connected fascially to everywhere else around your pelvis. So there are fascial connections to your back, to your hips, to your abdominal area, and to your legs. So if any of those areas are tight, that can actually create the pelvic pain and issues that you experience. So the exercises that we're going to do in this video are actually for loosening around that whole area and helping the fascia and the muscles to get back to more normal function. This exercise is a stretch for the front of your hips, which can also help to release up into your abdominal area. So to do this at home, use your bed. So if you lie on your back on your bed and allow one leg to just dangle off the side. So it doesn't matter if your foot is touching the floor or if it's dangling in the air, as long as you allow your leg to be nice and heavy and relaxed. This stretch helps progressively release the tissues in your thigh, front of your hip, and up into your abdomen, all of which are areas that can contribute to chronic pelvic pain. So as long as you're here for at least 2 minutes, the fascia and other tissues in this area will start to release and let go. In this exercise, we're going to stretch our adductor muscles. So the adductors are a group of muscles on the inside of your thighs that extend up into the groin area. And when the fascia and the muscles in this area get tight, they can affect pelvic pain. So this is a good way to help to start to release this area. So when you start to do this, sitting on the floor, have your feet, soles of your feet together, and just allow your legs to drop out. So you're not forcing it, you're just allowing the weight of your legs to create the stretch. So sometimes for people this is enough to do the stretch like this, but if this area is very tight, you might actually find that this is too uncomfortable. In which case you should use some pillows as props just to support your legs. So you can put pillows on either side underneath your legs, and this just allows this area to relax without you feeling that you're getting too much of a stretch that's creating pain. And as with all fascial stretches, as long as you're in this place for at least a couple of minutes, you'll start to release your fascia. To progress the stretch, you can start to bring your feet closer towards you, and this will deepen the stretch more. But again, waiting for at least 2 minutes each time you change position. So in this exercise, we're going to do a fascial squat. So this is not the type of squatting you do at the gym. This is a progressive squat that allows your joints and your tissues to start to release. So to do this, if you come into a squatting position, make sure that your feet are flat on the floor and have your arms inside of your knees, so you can start to use your arms just to lever your legs open a little bit more. So when you do fascial squatting, the important thing is to allow your bottom to relax and drop down. This helps to release your pelvic floor and takes the tissues there out of spasm. It also, as a squat, it helps to open out the joints in your hips, your knees and your ankles, which can get very tight and very restricted. When you first start to do this, you may find that it's quite tricky, and as you relax you actually get a sense you're going to fall over backwards. If that's the case, then you can hold on to something. So you could hold on to a door frame or a solid piece of furniture that can take your weight. And by doing that, it means that you can allow yourself just to relax and drop back a bit more. And when you first start to do this, maybe just do it for a minute and then come out of it, and progressively over time you'll find that you can do this for longer and it becomes more comfortable. In this exercise we're going to do a stretch that helps to open out the front line of your body. So by that I mean everything from your feet up through your legs, your abdominal area, your chest into your head. So to do this, very simple, you just lie on the floor with your legs flat, and if it's comfortable, bring your arms up over your head. And so you can create a slight sense of stretch just by stretching out your arms and your legs away from you. So you'll feel a stretch in your abdominal area. And when you do this, you can do it for a couple of minutes, just to allow time for the fascia and the muscles in your abdomen to start to release and let go. If you want a deeper stretch, you can lie on a rolled up towel. In this exercise I'm going to use a couple of myofascial release balls to work on the muscles and fascia in my buttocks. So these balls are good to use because they are inflatable, which means that they have enough pressure to allow the fascia to start to release, but they also have some give, so they're not too much pressure. So I'm going to turn sideways on so you can see what I'm doing. So you can either work with one ball or two balls at a time, depending on how comfortable this feels and how your balance is. So you can do this sitting on the floor or sitting on a chair or even on your bed. And if you find it's difficult to balance just sitting on the floor like this, then you can lean with your back against a sofa or the wall for support. The main thing is to make sure that your body feels relaxed and balanced so that you can allow your buttocks just to let go and soften around the balls. So as long as you're here for at least a couple of minutes, this will allow the fascia and the muscles to start to release and let go. In this exercise I'm going to work on the side of my hip using a myofascial ball. So to do this I'm going to just turn sideways on to show you where to work. So if you feel along the top of your pelvic bone here, and then you want to be about an inch or so below that, where the muscles of your buttocks, your gluteal muscles, actually wrap round the side of your hip. So to work here I'm going to use the ball. I'm going to lie on the ball and just allow my body to relax around the ball. So if it's comfortable, you can just allow yourself to lie more relaxed so that your body is really draped over the ball. And you're allowing your tissues over the next couple of minutes just to release and let go. Sometimes people find that this is too uncomfortable, in which case you could do this on your bed instead. Or if that's also too uncomfortable, you could lean against a wall with the ball so that you actually then can vary the pressure. So whichever way you want to do this is fine, The main thing is, whenever you're on a spot, to be there for at least a couple of minutes, to allow time for your fascia to release and let go. So the exercises we've covered in this video are all designed to help with chronic pelvic pain symptoms. And so if you do these regularly, they should start to help ease some of the pain and other symptoms that you experience. You can find these videos in our Living Pain Free online video program, which is available through our website, as is our Myofascial Release Kit.